Well, thank you so much for joining us here today. We are here to celebrate yet another amazing commitment of support from our friends at the Robinson Foundation, who in total have contributed over $1 million to hospitals in Kingston since the inception of the foundation. So we are very, very honored to have Michael, who also serves as a member of the University Hospital's Kingston Foundation, here with us today on behalf of the Samuel Robinson Foundation. We have lots of other folks with us today, and I'll try quickly to go through. Bittu George is here on behalf of the University Hospital's Kingston Foundation Board and also the KGH Foundation Board. Dr. Martin tenHove to my left is the head of the Ophthalmology program. Beth Young is a program manager in a number of clinical programs, including ophthalmology. Dr. Roger Deeley is the Vice President of Research at KGH and in leadership roles in research both with the Cancer Program and also with Queen's University. Richard Kizel is our past chair of the University Hospital's Kingston Foundation. Nancy Jurek is a development officer in our foundation. Elizabeth Barden is our Chief Community Relations Officer for Hotel Dieu. Out in the hall I see Mike McDonald, who is the acting Chief Nursing Executive. I don't see who's to Mike's right there. Oh, Krista Wells-Pearson, Director of Joint Planning. And then we've got some foundation staff out there as well. So we're gathered here today to talk a little bit about a phenomenal commitment made by the members of the Robinson Foundation Board to the work of Hotel Dieu Hospital and KGH. And so I'm going to turn things over to Michael to make the big announcement.
Okay, boy, that's pretty impressive that you were out. Thanks, Denise. It's always a pleasure to work with Denise and the great, extraordinary staff of UHKF, and particularly on this particular pledge, I'd like to thank Nancy Jurek because she was very instrumental in helping us get to this stage. Normally I would be here with my friend and fellow trustee, Geraldine Tepper, but she's recuperating at KGH from a very serious illness. And it's just an example, I mean, of the extraordinary health care that we are lucky to get in this city, and we're fortunate, a city of our size, to have the incredible health care that we do, and she's getting much better, which is great. Just wrote down a few notes because I didn't want to forget anything here. So anyways, we're very pleased to announce that the Dr. Samuel S. Robinson Foundation is pledging $150,000 over 5 years, evenly split between the ophthalmology expansion at Hotel Dieu and the clinical investigation unit at the Kingston General Hospital. And we're very pleased to support the expansion of the ophthalmology department. This is a world-class department, which I understand serves over 300,000 people in the region, including my mother, and has, what, 60,000 patient visits a year, with the potential to go up to 75,000, which is quite incredible. The clinical research investigation unit will allow patients to have more access. This was particularly what interests the other members of the trustees of our foundation. They was going to provide more access to promising new advances in treatments, and as well as enhancing the ability to recruit exceptional physicians to Kingston and also to keep them here once they were here. So Dr. Samuel Robinson Charitable Foundation is delighted to champion research and patient care at Kingston's hospitals, and I know that my uncle would be very, very pleased to know that his foundation had made gifts totaling in excess of $1 million, $1.2 million, I think it is, yeah, to Kingston's Hospital. So thank you very much.
Thank you.
Michael, on behalf of the Board of Directors of the University Hospital's Kingston Foundation, we want to thank you, as well as the other trustees of the Robinson Foundation, for your very generous gift. As has been mentioned, your foundation has contributed over $1.2 million since 2005 to healthcare in southeastern Ontario, which is a tremendous gift. It shows your community spirit and the philanthropy that we can count on from community members such as yourself. And we're really thrilled with the fact that you're supporting two very important priority projects with our hospitals, the ophthalmology expansion at Hotel Dieu Hospital, as well as the clinical investigation unit at the Kingston General Hospital. With the ophthalmology expansion, we're able to provide better patient care, eye care, as well as eyesight treatment for our patients for many years to come, as well as with the clinical investigation unit, you'll be helping to ensure that patients have access to leading-edge technology and advances in medical treatment. So without your generous contribution, we wouldn't be able to do that. And on behalf of the Board of Directors of the University Hospitals Kingston Foundation, thank you very much for your generous support.
And at this point, I'd like to invite Dr. Deeley to make a few remarks more specifically about the clinical investigation unit.
Well, I really appreciate the opportunity of, on behalf of the research community in Kingston, of thanking Michael and the Robinson Foundation for their very generous gift, which is actually kickstarting the fundraising campaign for the clinical investigation unit. And as you've already heard, this unit will really provide patients with access to the type of research studies that we've not been able to carry out in Kingston before. And I'd just like to make the point that although the clinical investigation unit is located at KGH, it's being designed as a multi-user, multidisciplinary facility. So it's potentially a benefit for clinical investigators. It doesn't really matter whether they're working at KGH or Hotel Dieu or PC. So it's going to have a big impact on the clinical research scene in Kingston, and we're very appreciative of that. Thank you.
Dr. tenHove, would you like to say a little bit about the ophthalmology program?
Thanks, Denise. And before I do, I'd like to thank the entire foundation for their soldiering work, especially in this environment. It's so appreciated. Michael, to you and the entire Robinson Foundation, this is such a welcome gift. We are working very hard at providing top quality, world-class, as you say, eye care for our community, and we really do require this expansion, and it's such a great contribution and such a significant contribution towards building it. I understand the construction will start within weeks, so it's very timely as well. So I thank you, and on behalf of our director Beth Young and our manager Beth Young and our director Mike McDonald, I promise you we'll work hard at keeping up that reputation.
So just as we close, I wanted to share the news, and Michael may not know this, that we had a significant goal to accomplish in terms of finding community support for the expansion of the ophthalmology program. We are now just $40,000 short of the $900,000 goal. Your gift helped to move us that big chunk higher. So we are working hard to invite support from the community just to take us over the top and see that project done. But we thank you and all the directors of the Robinson Foundation very, very much for your leadership, for your vision, and for your investment in the health of this community. So thank you.
Start soon?
Perfect.